Welcome to another episode of Mera Doctor. In this episode, we'll be talking to Dr. Prashanth, ENT surgeon, where we'll be talking about breathing issues and snoring in children. Welcome, Dr. Prashanth.
Thank you.
So, could you tell us what are some of the common issues that children have in terms of breathing?
Well, the most common thing which any parent would observe with a kid is mouth breathing. They always see that the kid would be opening the mouth and breathing rather than breathing through his nose by closing the mouth. This is one of the very common symptoms. This is secondary usually to the adenoid hypertrophy.
Okay. What is adenoid hypertrophy?
So, adenoid is nothing but the third tonsil which is there behind the nose. So, in kids, usually till about the age of 7 years, this tonsil, the adenoid tonsil, will be enlarging. The reason why it was enlarging is because it is protecting the kid from getting the nose infection going into the lungs. So, it enlarges and prevents any kind of dust particles or bacteria entering into the lower airway. When this becomes excessive because of any kind of infection, any kind of allergy, the adenoid will enlarge bigger and bigger. It will come into the back of the nose. So once that comes into the back of the nose, the kid can't breathe through the nose. So he prefers to breathe through the mouth.
Okay. So when we say, we observe snoring in children, does that always indicate a problem or what happens?
Snoring is always pathological. It doesn't mean that kid who is having snoring is having deep sleep. No, it's not that. There's a common misconception. Whenever a kid has snoring, it has to be evaluated because snoring is dangerous.
Okay, so when you say pathological, it means it is dangerous. It is secondary to some problem that is indicated through this as a symptom.
Yes. So snoring basically occurs in kids because, as I explained, the adenoid is getting enlarged. So what happens, the kid tends to open the mouth and breathe. Secondary to the mouth breathing, when the kid opens the mouth, the tongue is in between the hard palate and the jaw. So when the kid opens the mouth, the tongue falls back and it leads to snoring. So what happens during snoring might be your next question. Why is it so difficult, you might ask. So when the kid starts snoring, the main symptom or the main pathophysiology is that the kid is not getting good oxygen when he's sleeping. And everyone knows that the brain development occurs maximum during sleeping. So because of not breathing through the nose and breathing through the mouth, the kid is not getting sufficient oxygen because of the tongue fallback.
Okay.
Secondary to which, there will be growth stunting, there will be less amount of mental activity. The kid can present as a hyperactive child. And also hyperactive in a sense that the kid is not concentrating on one task. If you give a kid, okay, do this task, he or she won't be able to finish the task. Before finishing, they'll be doing multiple other things.
Okay. So I've also heard about symptoms where the kid can't breathe, as in this breathing stops for a few seconds and then it continues. And we as parents might just look at it as just a snoring or a part of it. But you're saying it's much deeper than just snoring.
Yes, it is way deeper. The reason why the kid kind of stops breathing or this cessation of breathing is because of the tongue falling back. So when the kid has very difficult breathing, he or she will just choke and get up. When the kid gets up, the tongue kind of sits back in front and he or she will start breathing, and then the normal breathing will restore.
Okay. So is that lack of breathing, or I could say lack of sleep, because of which they keep waking up very often and then there is lack of sleep, right? Is that because of which there is a hindrance to the brain development, or is it more to do with the lack of oxygen that's going in?
It's both. Because your tongue is falling back, though you're not able to breathe normally, so your oxygen saturation in the blood will drop. Because secondary to that, the kid keeps waking up, and getting up doesn't mean that he or she is fully wide awake. It's just that the kid momentarily wakes up, corrects the tongue, again goes back to sleep. Because he's not getting the full-fledged sleep, the deep sleep which is required for brain development, the kid's mental activity also will reduce.
This may be a little off the topic, but what's the recommended time duration till which a child needs to sleep, or what's the length of the sleep?
So it depends from age to age. When they are newborn, they have to sleep for almost 20 hours a day. As they grow older, they have to that sleep time will reduce. So a normal sleep time beyond 2 years of age is around 6 to 8 hours, just like a normal adult.
Okay. And you were talking about the behavioral symptoms, right? If parents are not able to observe any snoring, or if they have not been able to observe any sleeping disorders as such, can just the behaviors indicate any sort of abnormality in the behavior, irritation or being very anxious? Will that indicate some sort of an issue with the breathing also, or is it completely unrelated?
Yeah, so some of the symptoms which usually are associated with adenoids is bedwetting. Bedwetting is another common symptom of snoring. Second, other things would be waking up the kid in the morning will be difficult. They are not very active in the morning because they won't have slept properly. The other symptom, as I explained, would be the hyperactivity because of they are not concentrating on one task given. So these are the few symptoms which can raise red flags for the adults, for the parents.
And what about kids who sleep during the night and or during the day? Is there any difference in pattern that is usually seen?
In what way do you want?
If a kid is suffering with this issue, or what is this problem called as such? It's not just snoring, I'm guessing.
It's called obstructive sleep apnea. If it is in adults, it's called obstructive sleep apnea syndrome.
So when it's obstructive sleep apnea, so in a child, is it more during the night or day, or it doesn't really matter?
It doesn't really matter because when you sleep, the kid is obviously going to breathe through the mouth. So that's when the tongue will fall back. So it doesn't matter whether it's in the night or day. Anytime the kid is sleeping, he will have obstructive sleep apnea.
Okay. And also, is it impacted by let's say the tonsillitis or tonsils also? So if a child is having issues with the tonsils, does this aggravate that, or it's a kind of a different issue altogether?
It's the same issue, just it's vice versa.
Okay.
It's the adenoids which get infected, secondary to which the tonsils get infected.
Okay.
Because the adenoids is above and tonsils are below. So when there's infection here, it will trickle down to the tonsil and tonsils get enlarged. So both are interdependent.
Okay, so it could be the other way around as well.
Very less likely, because the primary source of infection will be the adenoid, which will be causing the tonsillitis.
Okay. And what about nasal voice? Does that also indicate, or is nasal voice itself something which is a cause to concern as such?
So yeah, very good thing. So nasal voice is usually because it is hyponasal, because the kid is not able to push the air through the nose. So that's why hyponasal voice is created.
Okay.
So it is one of the indicators for an adenoid hypertrophy.
Okay.
Another most common thing which anyone can see is the nose is always stuffy.
Okay.
There will be mucoid discharge which will be coming out from the front of the nose, which is another most common feature which raises a big red flag for adenoid.
Okay. So we spoke about some of these symptoms, right? Are there some home remedies or something that we could do at home to try and reduce it or prevent it if possible? And at what stage do we actually go and approach medical help?
So if the kid is constantly snoring, not having good sleep, that's when you immediately have to come and visit a ENT. Home remedies would be steam inhalation, because steam inhalation will help reduce the mucoid secretions, which is that it also washes off the allergic triggers, which will cause the adenoid to get hypertrophy. So steam inhalation. Another better suggestion would be the raw honey which you get. So any organic honey, 1 spoon every day underneath the tongue will help reduce the allergic symptoms, which also in turn will reduce the size of the adenoid.
Okay. And so it is better, I'm guessing, that it's organic rather than any other source of food.
Yes.
Right? Because it's for more medicinal reasons.
Yes.
And what about many of these children when they are sleeping? Let's say if they are snoring, but they're not showing any other symptoms. It could be that they're not irritable, they're waking up on time, they're able to manage everything else. Does it indicate that snoring is still normal, or is it still something we need to watch?
It's better to be getting evaluated, because kids who have the early onset of adenoids will not have all the other issues what we just told.
Okay.
It might just be the snoring which will be the first sign of adenoid hypertrophy.
So that brings me to the question, how do we take care of the issue? Once we identify this, let's say we approach a doctor, what are some of the things that we might have to look at?
So I personally would get an X-ray done, X-ray of the adenoids, to check how big the adenoids are. If it's more than 50% of the obstruction, I would recommend them to undergo a surgery. If it is less than 50%, I would give them some amount of nasal sprays which will help shrink the adenoid tissue. So these are the two modalities of treatment which are available. One is medical, one is surgical. Surgical is when it's more than 50% of obstruction of the nasal airway.
Okay, that actually brings me to two more questions. When we look at this, we generally wonder, if the pollution in the air or all these act as allergic, sources, and is that leading to any of these issues, or is it just the way the immunity of the child is?
Well, these are all the add-on factors, which is the reason why I'm seeing more and more number of kids having allergic features, secondary to which they are developing adenoid hypertrophy.
Okay.
So it's definitely adding as a add-on effect or a multiplying effect, which is causing more worsening of the symptoms and the adenoids in kids.
Okay, so it's the adenoids getting affected can be because of their own immunity, and it can definitely be impacted by the allergic sources as well. So when we talk about these, how can we prevent it?
So prevention is, well, it's very difficult to say exactly how to prevent it, because adenoid as such is a protective mechanism by the human body to prevent infection. Mm-hmm. If that only is a source of problem, it's better to be removing it than keeping it and causing the whole body to suffer because of that small tissue.
Okay, and so when we say removing the adenoids, is it very similar to getting tonsils removed, or is it some cases where both the tonsils and the adenoid has to be removed, or how does it work?
So yeah, it's a part of the tonsillectomy. Adenoidectomy is also done in combination. At times, if there's no tonsillar involvement, only the adenoid is involved, we'll just do an adenoidectomy, and then that will cure the kid of not breathing through the nose. And I personally have seen so many kids who have got sudden growth spurts. They have gained 2 or 3 inches height in just 2 months' time after the adenoid surgery.
Oh, okay, so it will definitely show up as a result.
Yes.
Okay, and can we? So when you say the growth is stunted and their learning, their brain development is also stunted. So is there some sort of a ratio we're looking at it in India? Because I think in India we don't take a lot of care about these things. We're not able to identify it very early.
Not true. So there is the growth charts which all the pediatricians will have. I'm sure immediately after the birth you have the growth chart to check in which percentile your kid is. So based on that only we'll get to know how the kid is growing. So there will be growth charts given by all the pediatricians. They will check. So based on the growth chart, you will definitely get to know.
Okay. So if you're regularly visiting a pediatrician, there is a very good chance we'll be able to identify this early and take care of it
at the earliest.
Okay. So early care would mean we can avoid a surgery. Would that be
yes.
true? Okay. Right. All right. Then thank you, doctor. We'll catch up in another episode then.
Thank you.